COVID-19 infections and hospitalizations have been dropping nationally, but some health experts predict the worst weeks of the virus might still be ahead. In Nevada, as elsewhere, one of the key tools in trying to control the spread has been contact tracing, where those confirmed to have COVID are contacted by health officials. While employees who've worked inside the local program say it is a miserable failure. The I-Team's George Knapp has our story.
Tens of thousands of eligible Nevadans have struggled to get appointments for a COVID vaccination, let alone get a second shot. If you're wondering why the system is so messed up, the seeds may have been planted 11 months ago when the health district struggled to implement basic plans, including a program for contact tracing.
There's been so many delays where by the time you reach people that are positive, it's already too late. They're already well again, and we can't even begin to imagine how far it's spread to other people.
Until a few months ago, John worked for the Southern Nevada Health District as a contact tracer. Each day, he was assigned a file of 10 to 20 cases, people who had tested positive for COVID. It was his job to contact the infected person and identify who else may have been infected. In practice, he says, tracers were never able to finish their daily lists. The delays between the time people were tested and when they were informed of the results grew from days to weeks to a month or more.
Sometimes we had no idea that the person has already died.
So you're calling the family to tell them, hey, you test positive, but they're already dead.
That's right.
What's the reaction been like from the family members?
It's been a mix of anger, sad, upset, looking for someone to blame.
By September, John says, the backlog for contact tracers was 15,000 infected people who had not been contacted. Then it grew to 25,000. James is another former health district employee who confirmed the size of the backlog and the chaos within the district.
It's just a disaster. It started from the beginning where there just wasn't never enough contact tracers, and once there's not enough contact tracers, then it just gets more and more behind, and then it just becomes where contact tracing is useless. Contacting people that showed positive a month ago, it doesn't do anything.
Although contact tracing has worked well in other countries, it's been a failure across much of the U.S., in part because Americans find it intrusive or believe the virus is a hoax or simply don't answer the phone. Epidemiologist Dr. Arturo Moreto says one reason the local health district hasn't stood out as a miserable failure is because so many other health districts have done poorly as well.
But, it's leading. Good thing for the health district. The whole nation is not, doing well. And that's the only thing that is actually maybe that they can use an excuse.
Arturo Moreto spent almost 10 years with the health district and specialized in contact tracing, specifically for HIV cases. It works, he says, but not as implemented for COVID. Many of the senior managers at the district were hired or promoted by former Chief Joe Iser, not for their expertise or training, he says, but for their loyalty to Iser. Moreto says he discovered the district making inflated claims to the state about the success of its contact tracing. After he reported it to the state, he was fired.
Because they were claiming 15-20% of the cases were being found or identified through contact tracing. And that was an absolute lie.
Moreto has previous experience as a whistleblower at the health district and has spoken out about senior managers lacking the most basic credentials for dealing with infectious diseases. More on that in the days ahead. George Knapp, 8 News Now.
Now, George sought an interview with the health district, but the district declined. A spokesperson did answer several questions that we submitted in writing, saying the contact tracing program has been able to, quote, adequately respond to COVID, except during the summer surge of cases, end quote. You can read the full response on our website.